Good afternoon, everybody. If you can hear me and you haven't popped your headsets on, that should be great. Thank you. Okay, so we're just going to kick off now with a quick introduction. Thank you very much for joining this session. We're delighted today to introduce Jeremy Porteus to you all. He'll be delivering a presentation on healthy homes for a healthier ageing population. Jeremy was formerly a national lead for housing at the Department for Health, responsible for Extra Care Housing Capital Fund and Prevention Technology Grant Programme. After leaving the department, he founded the Independent Housing, Learning and Improvement Network, bringing together over 20,000 housing, health and social care practitioners in England, Wales and Scotland to identify and showcase innovative housing and technology-enabled solutions for an ageing population. During his time at the Department of Health, Jeremy will be sharing some insights on the policy landscape and why the integration of health and housing matters to the delivery system improvements and achieve a better patient outcomes. Without further ado, over to yourself, Jeremy.
Thanks very much, and I hope you can hear me. I'm the warm-up act to Glastonbury, so now you've got your headphones on, I'll spin some music about integration for you. Charlotte said I've got a long history of working in housing, but in particular within a health context. So I'm going to draw attention to that national policy landscape and why it's really important to look at what integration means in relation to the homes and places that we all live in, and why healthy communities are a prerequisite, really. In addition to formerly being at the Department of Health, we set up the Housing, Learning and Improvement Network, or Housing LIN for short, to diffuse best practice, to support policy implementation with both local government, local health systems and housing organisations, to look at how to improve driving collaborative working, partnership working, and looking about sharing of knowledge to deliver better both patient outcomes but resident and citizen-led outcomes as well. So I'm hoping that if you're not a member of the LIN, that you may wish to do so. It's a free portal. We're very grateful for our corporate sponsors, and in fact Arcadis are here with us today, particularly around health and housing, when we can inspire and continue to share those ideas and practice to you all. However, I wanted to kick off by a recent report by Chris Whitty. Many of you will know Chris Whitty from his days through the pandemic, every morning at the briefing talking about the rise and the terrible consequences of COVID and the pandemic and the impact on us as a population from tackling health inequalities. He is the Chief Medical Officer for England, and my talk, I know we have some colleagues from Scotland in the room, is predominantly around the English context. But he was very much thinking that where we live is an important aspect, and the way we interact with our place of living and the health of that community is really important, so that we can live healthier, active and more independent life. And his recent report, The State of the Nation of Health in Our Ageing Society, picks out a number of key aspects that have a direct consequences on our everyday lives in relation to ageing, in terms of the quality and design of our homes, its accessibility in relation to whether it provides a hazard for a trip or a fall, and indeed for the NHS, trips and falls account for nearly £1.4 billion worth of expenditure per annum. Also the impact of cold homes, and we all know that through issues in terms of damp and mould, but also then the impact on respiratory and health conditions and the long-term conditions. The overheating of our homes, damp and mould, as I said, and unsafeness and the inaccessibility, and then also the wider built environment. So Chris Whitty, right from the outset in his recent report, highlights that we need to really tackle not just the health inequalities in England, but also the housing inequity, and think about how we can improve the quality of our house. And that's what I've been asked to talk about this afternoon. At a local level, I want to just draw your attention to a partnership that's been developed across Greater Manchester. For any of you working either in the 10 local authorities in Manchester or in the housing, social housing or the commercial sector in housing, there is a joint memorandum of understanding. This is a forerunner to some of the work around integration, about binding approaches as a strategic approach to thinking about how to create across neighbourhoods here, across Greater Manchester, better homes and better neighbourhoods. And the reason is because it's about better health. And as I go through my presentation, I want to try and impress on you the dividend of getting our housing right in terms of both our personal well-being aspects, but also the financial consequences in terms of a time when public finances are extremely tight. For this document, a tripartite agreement or a memorandum of understanding looks at how at a higher level there can be more effective system leadership through our integrated care boards, our health and well-being boards, but also use the data that we have around our local populations to better predict what the type of demand might be, not just for housing, but also health interventions to prevent and reduce illness and poor health. And as a result of that, then developing solutions with workforce and with local customers around primary preventative services so that we can deliver the right support. So this is a really good example at a local level of what that national delivery that Chris Whitty referred to in his seminal paper earlier this year. I mentioned the Housing Lin is a knowledge exchange platform. We also do some work for organisations on a consultancy basis, and we've built up the evidence base thinking about what is the importance for health and housing in this piece of work for the academic science networks funded by the NHS. And what we saw is that if we can get our health and housing right, we can support a reduction and some of that preventative elements in terms of people entering the system. It will help people in public health at that primary level about better active living through exercise, through eating, through better drinking, smoking cessation, things that we all know about in terms of a public health message, but often don't think about in relation to housing. Warwickshire Age UK work with their local public health agencies to look at smoking cessation because they are worked out that on average a social housing tenant is spending £50 a week on cigarettes, at the same time having significant rent arrears. So how can they sort of make those links between a public health message but also thinking from a housing management about preventing homelessness or in this case arrears rising. So again, helping people in terms of supporting their independence so that they're less dependent on the system, whether it's about entering the system or the likely demand for using that system. For example, people coming out of hospital, to enable them to be supported at home through better recovery, reablement or recuperation, home from hospital services, the use of floating support, telecare and telemedicine, the role of extra care housing. These are all really good examples where housing and technology can play an important role in both reducing demand but also preventing people entering the system. And then finally, linking back to Chris Whitty, looking at those wider determinants of health, thinking about our neighbourhoods, what are the housing choices that we have the right places for people to right size, downsize, move on to? Are our homes energy efficient? Can we tackle fuel poverty? Do we have the right equipment and the advice services to enable people to make choices that link not just their housing choices, but also their health choices? So again, the Housing Lin has documented a lot of this in documents like this report, which looks at the evidence base. Some work we did with the National Housing Federation a few years ago also sort of builds on this, and it's a really important statement that the link between health and housing is critical, but the third part of this equation is also social care. So many of you will be working closely with your local authorities with adult social care responsibility, and they will be looking at reducing domiciliary or improving the way domiciliary care and support can be delivered to people at home, whether that's in specialist housing like sheltered housing or extra care or supported living, or indeed for many people across all tenures in mainstream housing as well. There's also cost-benefit argument as well that's been highlighted in this report about delaying admission to residential care. If one can prevent admission to residential care by at least a year, that will save local social services £26,000 a year. The trick is to unlock that money to reinvest it into primary and frontline services from a housing, and that's where that integration and partnership through those integrated care boards, things like the Better Care Fund and other mechanisms play a role, and particularly from an English context. And you can see there are a number of bullet points here which highlight about why the links between health and housing, about facilitating easier flows of discharge planning or readmissions into hospital, supporting improved carer relationships, reducing the likelihood of carer breakdown, something that was picked up last week in Carers Week, assisting with the management of things like falling, which I've already highlighted as a key cost to the NHS, both for A&E services, but also in terms of geriatric services as well, because a high proportion of people in falls are elderly people. And other things around supporting medication compliance and risk stratification, around looking at the types of care pathways to provide the right move on accommodation to people and how to stratify those. So if you're interested in a variety of examples, you can access this through those high impact changes and the types of dividends and the financial benefits of doing so. Some of the work that we've been doing at a local level within local health and housing systems often finds that there's a mismatch about the lexicon of housing and the language of health. A misunderstanding about what we do in our different organisations or in our different economies. And we need to make sure that we can navigate those and help housing and health professionals have a better understanding about the types of tasks that we undertake, but also the types of outcomes that they deliver. So the sorts of issues we wanted to highlight in this paper was about the specialist housing in relation to health and social care has a real impact on health and social care because it delays a move to residential or nursing care. Equally, housing support from a health perspective can also prevent homelessness and readmissions and frequent readmissions to acute services, mental health, psychotic and forensic services, as well as supporting people with their well-being. Mainstream housing, the way we design it, has a health gain if we get the right housing right in terms of the accessibility and adaptability to enable people to live independently in their homes, or as we have in the happy design principles, something what we call care readiness, to make sure our homes are ready for future care. The role of home improvement agencies is really important, and recent report by the Centre for Ageing Better and by Demos highlights that we need, there's a triple dividend if we can get our good homes and our housing right for reducing those hazards and fuel poverty that I referred to. Again, have a look at that report if you need further information. Again, Manchester's got a very good example of care and repair agencies that do that. The wider environmental benefits are there, as are the regeneration. And look, today, the Town and Country Planning Act Association have published a report looking at spatial planning. How can our planning authorities build in healthy neighbourhoods for the future? Something that the Labour government, if they come into power, that is, are interested in taking forward. Working with local systems, the integrated care systems and the partnership boards. Now, does this work? Well, I wanted just to share with you some of the high level stuff, but also at a local level, this definitely works. This is an example of one of those healthy homes hubs that the Derby City Council have developed. And the evidence that they've built using health economics demonstrates that by providing a range of services, housing related advice and support, prescribed housing support, healthy housing assistance, working in partnership across housing, health and social care and the voluntary sector, and evaluating that can demonstrate a number of important outcomes. And the 6 boxes here give you an idea of what those are. So in terms of frequent admissions and readmissions into acute services, and particularly A&E, they saw by having a healthy housing hub, there was a reduction of nearly 40% admissions. In terms of acute hospitals, that increased to nearly 55%. They saw that there were fewer direct hospital admissions by about 20%. But I think one of the key things for me are the two final things. One is that 91% of clients still are in their homes after 12 months, and nearly 90% felt the benefit of having this type of service in improving their health and well-being, in particularly reducing any anxiety and loss of confidence. So again, examples are out there. The real trick is how we can help you and share that learning to implement and develop these services at a local level more widely. So, are any of you working in health directly at the moment? Sort of, okay. Who do you speak to? That's one of the real challenges. When I go to meetings within local health economies, over the years, I've found that the person changes. They may have the same job title, but it's never the same person. And partly because many of our health colleagues are working in the front line at the coalface and don't have time to come out of patient direct services to support more strategic partnerships. So engaging with your local practice manager at the GP services is a really good example, rather than talking to the GP directly in the first instance, to find out, how is that practice working across the piece and their patch around health improvement, and where does housing fit in that? At a strategic level, does your Director of Public Health have a role to play? That's now based in the local authority. Conversations with them as they develop their health improvement plans and the strategic health needs assessments. Many of those now include housing, because it then accesses capital funding through the Better Care Fund to demonstrate the need for things like aids adaptations, telecare, community equipment services. What's the type of health intelligence that you have in your organisations about the state of the health of your populations, both your resident populations or your localities that you operate in? Do you have conversations with organisations that represent patients' voices, like Health Watch? They do a fantastic job locally to look at the lived experience and where social prescribing and other types of services can enable people to take more control over their health and their health conditions. And finally, about how to support people with healthy living. What type of health equity audits do you take in your localities to understand your residents' particular needs, so that you can predict and future-proof your services in case they should need the type of support and interventions that are required? So often the sorts of support that they require from you are the same support they require from other public services. So they are very highly dependent, can be a very highly dependent population. So, some ideas for next steps. I mentioned evidence. Often localities need really important evidence to demonstrate the case, the financial case, the business case for investing in housing and health services. Southampton City Council did a piece of work across the local government and housing and health, and identified that if they provided better move-on accommodation to sheltered and extra care housing, they could save up to £30 million a year in reduced admissions into acute services, but also in primary and secondary care. The challenge is then unlocking that money to give it back to housing, but as a total place in terms of the public purse, there was significant housing benefits in terms of increasing the choices available, but also from the public purse, making savings to that public purse by providing and re-providing a number of services across Southampton. There are also a number of really excellent hospital to home schemes where people are supported to recuperate and rehabilitate, provide intermediate care services. And examples here include in London, the Whittington Health Trust, who work with One Housing Association, now part of Riverside, in a scheme in Haringey where they provide step-down facilities for people coming out of hospital into intermediate care in an extra care scheme, so that at a point when they want to either move into a home, or what often happens is that they actually move into Protheroe's house, they are fully re-abled and enabled to live independently again. And Oxford City Council during COVID developed a rapid response disabled facility grant services to enable people being discharged to have their homes repaired. Often people with no running water, no heating, poor ventilation, things that had a direct impact on their personal physical health. So again, some really good examples about how the system benefits of integrating housing and health. So, I think I've had this one up before. I went the wrong way, sorry. So, how to take some of this forward? Well, part of this is about how can you build your community chest of examples. Can you develop a variety of both health interventions, housing interventions, and things that support people's lifestyles? What's the offer that's available in your locality? Do you have the right retirement living solutions for an ageing population? Do people want to stay put? Do they want to move to more purpose-built retirement communities, retirement villages, integrated care schemes, sheltered housing or extra care? Are there the appropriate hub and spoke models in your locality? Can we use technology to enable that and facilitate that? We've got a couple of people here from Scotland who are champions on telecare on the front row, who have demonstrated through a technology approach called TAPI, Technology for an Ageing Population Panel for Innovation, and I think you're speaking tomorrow from memory, or spoke this morning, and they are looking specifically at how technology can play a greater role, anything from the use of smartphones through utilities, through telecare, community alarms. The key thing is about how that's integrated and interoperable to enable it to be person-centred and controlled by residents. And I think that's really important, because I think if this is going to work, integrating housing and health, making it work, we need to make sure that these are consumer or citizen or resident-led solutions. That could be from co-housing or mutual housing associations to community-led approaches to, I have got home share in my slides. Guys here from Home Share International, really good example. And ultimately also to think about intergenerational living. This is not just about us in the future, this is also about us now. So drawing to a close, can we create a new pathway to citizenship which enables our health and well-being to be paramount? Drawing on Chris Whitty's sort of statements around how we can improve our lifestyle and our life course. Some of this is about creating more citizen activation to create through the lived experience that I've talked about, self-advocacy to enable communities to be empowered to develop a range of collaborative health and housing solutions. Some could be planned with your local authorities through organisations like the local area coordination networks, or it could be self-care, what we call an anatomy of resilience. How do we create more resilient communities? Another really good example is social prescribing, where local authorities working with local communities are giving resources to enable those communities to take more control about their responsibilities and the outcomes they want to deliver. The self-directed support, often linked through either personal budgets or personal health budgets in England. And we've got another variety of services right across England, community circles in Wigan, home share again, as well as volunteering and befriending services, some of the work that the RSVWs and others are doing. Often this is all about delivering better outcomes, making sure that we work to the NEF, the New Economic Foundation's 5 ways of well-being, to make those quality of life improvements. And a few others which we think are really important about how do we increase choice and control for residents through co-production and citizen-led commissioning, about how users can commission services and procure services. So it's not just procurement for housing, it's also procurement for care. And then ABCD, asset-based community development. How do we create a social architecture to support local networks to build that capital, to make sure they have community builder, village agents and others in local areas. But all of this requires improved integrated working through partnerships and networking opportunities. And some of those are called community connectors, collaborative care networks, or as I said, local area coordination. It's a term that Housing Lin coins collaborage, and we have a whole directory on our website looking at collaborative models of health, housing and care. Now, I just want to leave you with a couple of final things. If you aren't aware, the Town and Country Planning Association have released a report this morning, but it's based on something called a Healthy Homes Pledge. They really want to encourage local communities to sign up to this pledge, where they can ensure that all the housing is of high quality provision. It protects and promotes all residents' physical, mental and social well-being, want to meet a number of principles they've set out. It's also about making sure that people are engaged, involved with this, so that people can be part of that decision-making process and make sure that we're creating benefits and not harm to our health in the types of housing we're building and the communities we're managing. They also want us to pledge to support the provision of affordable homes, a really important point. And with an incoming government, most parties are committed to creating more affordable homes, and also to create safety to people so that our homes don't kill us. A number of housing, the quality of our homes, radon, a number of other aspects have particular impacts on the environmental health of our housing as well. So if you aren't aware of the Healthy Homes Pledge, please do sign up to it, and the link is on the bottom of this page, so do take a picture of it before I move on. And with an election next week, just some final thoughts about what could a government do. We've heard about, we need build to rent, we need rent to buy. Well, I think we need a new framework of build to retire. So the new BTR model is, how do we scale up provision of extra care housing, assisted living and retirement housing solutions? From a health perspective, how can we create a housing first model? So we have housing options as part of services, so that when you are admitted into hospital, you automatically have to disclose where you've got capacity about your housing situation, so that when you're discharged, you automatically are in the system and people know what type of home you're moving to. That may prevent admission, but also may support readmissions in future. Can we link into a Healthy Homes Charter, building on that pledge that I described? Can we look at ways to promote independence, more importantly, not just for older people, but across all adults, including people with long-term conditions with mental health, learning disability, and people with autism? The Derby City Council model I refer to, the Healthy Homes Hub, is a programme that is being trialled in a number of areas. It would be great if we could see a rapid rollout of those. And we know that one or two of the parties are talking about creating more vibrant and healthy places, often in relation to developing general needs housing, but we need to make sure that those are age friendly and that they promote healthy lifestyles and exercise. So that's just some thoughts about where we could go after next week. So with that in mind, thank you.
Hello, my name's Tony Johnson. I'm from Health Watch, and I'm a member of the age-friendly board in Stockport.
Brilliant.
And amongst other things, I'm involved in the dementia, and which is chaired by the lead commissioner. Now, I think you've done a wonderful presentation, and I have been listening to your online talks, but somehow the reality on the ground is somewhat different. We have at Health Watch been consulted on the strategy, the housing strategy. Stockport's the only one that hasn't got one, and I did raise the question of supported tenancies for older people and the health benefits that would arise, but we were told health and social care wasn't, within his thoughts or the thoughts of the council, and that was set aside. But my main concern is that, as far as health and social care is concerned, that we have supported tenancies of a good standard, particularly for those who have or live in 4-bedroom houses on their own, which is underutilised. So it's the underutilisation of the existing housing stock, which is one of the things which is perhaps haven't been picked up, which I haven't mentioned on on our online, of course, and I think that's important because it does actually ensure that people are less likely to go to A&E, more likely to be discharged properly. But I think it needs to have some restaurant facilities on site, so it needs to be perhaps slightly larger than one would imagine. And I prefer them in the private sector because they can be recycled more promptly. And somebody who goes into a nursing home has got to continue to pay the service charge and the council tax until that is sold. So can we actually advance that? Because clearly it's not a question of building more houses, it's a question of utilising the existing housing stock. I'm 83 and I live in a 4-bedroom detached house, and I continue to live there because what I want is not available. But there are lots of people like myself, and if we moved into appropriate accommodation, then that would be wonderful. But the private sector ones, they're not they can't be recycled promptly. I continue to pay the service charge, and as I said, and we need to change. And thank you for that wonderful presentation.
Well, fine, but I mean, you highlight two things for me. One is that Health Watch should be more involved. I did refer to Health Watch. I think Salford have had quite a positive way, rather than Stockport perhaps. But there are a number of examples where Health Watchers have actively reviewed at sheltered housing, extra care housing, to see what the experience of their members are in those schemes. And there's some fantastic outcomes. So you could share those with the powers that be. My glass may be half full, you're right, but the examples that you highlight from operational management, we actually had a session earlier today which touched on exactly the points that you just referred to around downsizing, and perhaps we should have a conversation afterwards about that.
I just want to say thank you so much, Jeremy. It was very, very useful. My name is Sibel Whitehead. I'm Support Much Home Share Managing Director. I'm also Home Share International Board of Trustee. In England, we're trying to challenge that, utilising the current housing to make sure that two generations live together. However, one of the biggest issue that the council tax issue that is really stopping us, and we also find out that giving the people choice and control, that their later life, they need to be planned in advance, not with the crisis time. So like Irish government already sorted out, they asking people when they come before retired, what would you like to do when they come that age? Do you want to stay in your home or do you want to go to care home? And then they plan. So why don't we able to do this in this country? That we are one of the leading country that living in the whole world, this situation. Why we can not simply we can sort it out before the crisis comes. Thank you so much again.
Well, if you aren't aware of the work of Home Share and Shared Lives, do have a look at their website. My personal view is that it's still very much in the UK a micro enterprise, and we need to scale it up rapidly, and that needs both government intervention but also partnerships with yourselves and local government and housing to make that suitability, to create the housing offers that we heard aren't always available. Yeah, no, really important.
Yeah, thanks for that. That was really useful and interesting. My name's Maya Fitchett. I work for National Energy Action. We're the UK's leading fuel poverty charity. My question is around lots of the examples you gave were sort of regional or local based, which I think it has to be a sort of bottom-up approach to engage communities, empower communities, and provide those sort of localised responses based on sort of area-based vulnerabilities. My question for you is around how we can encourage national government to provide the framework for local authorities and local organisations to do the work that they've been doing. In other words, coming up to an election, how do we avoid a sort of postcode lottery emerging?
That's a great question. We have a postcode lottery already, let's be honest. The national frameworks we need are working with both your organisations, foundations, Homes England, a number to build the partnerships. But ultimately, from a health and housing perspective, I mentioned very early on that there's a tripartite agreement in Manchester. We actually have, at a national level, something called a Health and Housing Memorandum of Understanding. if that could be applied much more rigorously by an incoming government, that will help enable the dialogue to take place to help the transition that you describe needing, because energy efficiency, affordable warmth, fuel poverty, net zero, they're here, they're not going away. And if we don't get it right in the next 5-10 years, we've really got a challenge in the next 50 years for our future generations, for your generation. Yeah. Come and write a blog for us. Talk to Sally at the end.
Any more questions from the audience at all? So,
I was just going to comment on the fact that health and social care was devolved to Greater Manchester. It was started 10 years ago.
Yep.
And yet we haven't got any commitment to have health hubs with doctors, physiotherapists, social workers, and let's say physiotherapists, and perhaps
occupational therapy.
Yeah. And I was with my physiotherapist yesterday, and he was saying that a third of all conditions that are seen by doctors are musculoskeletal, and yet we don't have. How do we actually inject some urgency and some, because although there's devolution, there isn't accountability. The accountability isn't there.
Yeah. And I personally don't think that a national care service will sort it out overnight, but we need to build in things like that as well. So again, some examples from Scotland, where there is a commitment to that. It doesn't work perfectly, but we need to have the systems to enable those partnerships to work. So it's not about integration of the systems, it's about making your life easier so you're not having to navigate the system and the complexity of it. Because otherwise you're being referred from your GP to your specialist consultant, and maybe 6 months before you get that appointment, if you're lucky.
just on that point, Jeremy, you mentioned there's a number of like Derby City Council are doing a good job on this. What do you think are the key components in terms of a HA or a local authority driving their own network and getting better at this? What would you say you've witnessed that's worked really well?
I was going to start off with money, but it's actually individuals.
Yeah.
It's the passion and the compassion that individuals have for their clients, for their communities, that are driving it, which then percolates up to leadership at times.
Yeah.
When you get that right, then the dialogues, the negotiations, the money can flow. But it's getting the right, and then having the culture of the organisation to help facilitate that. So it's about people, leadership and culture for me.
Thank you. Any more questions from the audience at all?
Oh, hello. Nice to see you. How are you?
I have no question.
Oh, nothing from Wales? You've got integrated partnership boards, or you've got the...
Quite a few of those conversations are around health.
Say who you are.
So, my name's Carla Dix.
Yeah.
I work for a company called Delta Wellbeing. We're an alarm receiving centre, so very much involved in this sort of technology-enabled care, but have been working very closely with health and social care.
Yeah.
And we're probably slightly more integrated than across in England. However, there's still a gap for us with regards to housing, and we've got some of those agreements there from a health and housing, but the social care arm as well. So it's still not linked across the three, and it still amazes me that actually if we've got people that are living in properties that are actually impacting on their health and well-being, it clearly impacts on health and social care services, and there absolutely needs to be much more of a joined up approach to ensuring that we can get to that point and being more proactive. And from my point of view, in terms of some of the technology stuff, there's lots of monitoring going on of houses in terms of sort of mould and this, that, the other, all cold. If we can do that, we can actually monitor people in the way to actually ensure that actually their homes are actually fit for them, to stop them from hitting those, and actually then allowing them to live in these homes for longer to be suitable for them. So
and that has an impact on cost of living expenses, and
it's all connected.
It's all connected, yeah.
Thank you. Any further questions at all? No? Well, thank you for your time, Jeremy.
Well,
really good session.
Enjoy Glastonbury.
And thank you for attending.